Well, the arts can be a very powerful way of addressing many of the issues attached to end-of-life care. It can really help both patients and their families during that difficult time. Community Hospice of Northeast Florida is using creative arts therapy to touch, energize, to soothe, restore, and even heal patients. Joining me now is Stephen Choate, a certified music therapist. You also might recognize him from the commercials that air here on Channel 4, because I just turned to you and said, oh, I love those commercials. So you do what they do in the commercials, and that is you. That's a really good example of what you do. But for those that haven't seen that, can you kind of explain what a music therapist does?
Sure. So music therapists work in a variety of settings, and a lot of people are familiar with this idea that music is inherently therapeutic and good, and what music therapists do is what people may be less familiar with, and that is using music-based applications within for individualized goals within a therapeutic context. So they work in hospitals, hospices, and we see them in certain schools and a lot of mental health facilities. In hospice, we use music therapy as a modality to help people cope with end-of-life issues, for pain management, reducing anxiety, clinical symptoms, as well as addressing spiritual goals.
How do the patients react to you?
I hope pretty positively most of the time, and I think that's the case, because people just love music. It's something that everyone can connect to in some regard. So whenever I come in, I'm not being a nurse, I'm not carrying medications, or I'm not coming in as a doctor or psychosocial specialist. I say, hey, I'm here, can we talk about music, and put a little bit of music. People are very, very positive to it.
So when you're talking about end-of-life care, what are some of the ways that you're able to use the music therapy? What are some of the things that you do with the patients?
Sure. Well, it really depends on the goals, because this is completely patient-centered and individualized care, and people respond best to what they like, which makes sense, right? So again, depending on what those goals are is what's going to drive the technique that we're using. If we are looking at, so like I said earlier, clinical goals like addressing pain or reducing agitation, then we're going to use the patient's preferred music and use continuous music to reduce those symptoms. If it's more of a psychosocial goal and we're addressing something like depression, or we're trying to provide closure, maybe build a legacy project using music, then we're going to use music as a way to build that relationship with the patient, and maybe do songwriting, or maybe just use music to structure a conversation about the patient's life and lead in reminiscence.
So if there's someone right now that has a loved one that may be in end-of-life care, what really are the criteria for receiving this?
That's a good question, because not everyone is necessarily appropriate for music therapy. A lot of people like music and would love to have music be played for them at the bedside, but we do have a very specific list of things that we require people to assess, and it's usually a nurse or a psychosocial specialist. Those would be things like unmanaged pain, unmanaged anxiety or agitation, terminal restlessness. It could be emotional distress, it could be depression, isolation, or a lack of socialization or stimulation.
And through community hospice, I know it's also the diagnosis of a life-threatening illness, and then you have to be in either Duval, Clay St. John's, Nassau, and Baker counties as well.
Correct,
right?
Which are all the covers that we
Yes,
can.
Exactly, which covers all the area watching right now, too. Well, thank you so much for coming in and talking to us about it. And like I said, I mean, I loved learning about it and watching that commercial, so it's great to get a little more perspective on what you do. Appreciate it. And also, if you'd like to learn more about music therapy, especially with community hospice, you can call 904-407-6500. We've also, of course, posted a link on the morning show page of news4jax.com, so you can find out more there as well.